Welcome to the Cincinnati Birth and Parenting Show. My name is Molly Murray, and today we are live with Katie Coleman. Katie Coleman is a women's health physical therapist. And let's just go ahead and start the show with Katie. I'd love for you to share who you are and what services you provide.
Absolutely. First of all, I just want to say thank you so much, Molly, for inviting me to be on the show. And I apologize in advance if a little toddler comes running through to wish me, good night and things like that. So
Oh, no problem.
there's an interruption there. I am a doctor of physical therapy, and I specialize in pelvic health for men and for women.
Awesome.
So what does that mean exactly? Essentially, any kind of issue with the pelvic floor, which I'll kind of go into more detail about what that all entails a little bit later. So any kind of issue with the pelvic floor is kind of my specialty area.
Awesome.
So if you have any kind of issue with incontinence, either urinary or bowel incontinence, or any kind of issue with pelvic pain, and that can be a whole host of things ranging from actual pain in the pelvic area, pain with any kind of urination or bowel movement, abdominal pain, or any kind of pain in your low back area or hips. That's kind of all encompassed in the pelvis.
Okay.
So I deal with pelvic pain issues. And then I also love to work with women who are pregnant or thinking about getting pregnant, and then new moms. That's kind of my area that I really hold near and dear. Being a mom myself, I realize all the major changes that your body goes through, and just being able to kind of help coach you through those seasons postpartum, and just making sure that you have the tools to take care of yourself so you can help take care of your loved ones. So that's
Awesome.
kind of in a nutshell what pelvic therapy kind of entails. It is a program where coming out of PT school, you're not a licensed pelvic therapist per se.
Okay.
It is postdoctorate training. So actually where I got my interest in pelvic floor therapy was after my first son was born. I had fecal incontinence, meaning like couldn't hold
go for it.
number. Yeah, basically you're pooping your pants, that kind of stuff. So like very, very embarrassing, one of those things where you've never had any kinds of issue. I had never had any kinds of issues like that. And being able to work with other pelvic floor therapists to help get my body back made me realize I have to do this. This is a gift that we can help these women who have life-altering issues. And so that's where I said, okay, how do I sign up for this? How do I get involved with this?
Right.
So there are two main, there's the American Physical Therapy Association, and then there's also the Herman and Wallace Institute that's based out of New York City, and that's where you go for advanced training to become a pelvic floor therapist.
Awesome. Now, Katie, when you say the pelvic floor, what exactly does that mean?
That's a great question. So I brought my model home from work.
Oh, I'm going to give you the full screen. Hold on one second. Okay. There we go.
Nice. So can you see my pelvis here?
Yeah.
Right. So this is looking at it from the front view. This is our pubic bone.
Okay.
If I turn it around, you can see this is our tailbone in the back.
Awesome.
And if you pull out your internal organs, hold on a second. There we go. So we pull out the bladder, we pull out the uterus, and we pull out the rectum, and here's your ovaries and fallopian tubes. You're left with this nice little red thing at the bottom of the base of the pelvis. Those are your pelvic floor muscles. So I'm going to show you the view if you were looking straight up.
Okay.
The openings here, right? You can see the vagina. You can see the anus down here. The urethra is right up here. And all of these red things are the pelvic floor muscles that help support these internal organs and basically help manage the pressure that we create in our abdominal cavity.
I know you've been here.
That is so neat. You're good. I wonder, I often explain the pelvic floor like a hammock. Is that correct?
That's a really great way to think of it. A hammock that kind of runs, I'm going to turn the model to the side, from your pubic bone all the way back to your tailbone. So it is definitely a hammock type shape.
Yeah.
I mean, you can see it kind of has this bowl kind of quality to it.
Right.
And when we think about contracting those muscles, we think about not only do they pull up, but they also go in at the same time as well.
Right.
So yes, a hammock is a really nice way to think about it. And, you know, often women go, pelvic floor, I don't even know what you're talking about, because you can't see it, right? They're muscles that, yes, I think I'm doing a Kegel, maybe not. But I guess the thing that I want to stress to our viewers is that it's more than just Kegels. Because if it were as easy as doing Kegels, then you wouldn't need a pelvic floor therapist.
Right.
The nurse would just teach you, or the doula would teach you, okay, squeeze down there, and everything would be hunky-dory. But oftentimes, it's a matter of managing the pressure of the pelvic floor versus the diaphragm versus the abdominal muscles and the back muscles. It's trying to manage all of these muscles together to help create a system of pressure and balance and keep you from leaking or having pain.
Oh, you say that. Isn't leaking after having kids normal?
To some extent for the first few weeks. Yeah, maybe a little dribble here and there, I would say is not out of the realm of being normal. Most OBGYNs are going to say, you know, especially if you went through a vaginal birth, you just sustained severe trauma to these muscles.
Yeah.
However, if you're going in at like 6-8 weeks postpartum and you're still having leakage issues, that's when I would say, okay, you need to get in to see a physical therapist and make sure that there's not something more seriously, not wrong, but you've probably just, you need to relearn the strategies to make those muscles work better in conjunction with the rest of your abdominal muscles.
Yeah, that makes so much sense. I see so many products marketed to moms or just even friends talking and thinking that it's normal to leak post-baby.
Oh, right. I mean, there's a whole market out there of feminine, you know, napkins and continence pads and things like that. And I see it in my Oprah magazine every month, and it just drives me crazy that people think this is normal, but it's not. Even as you age, you really should not be having any leakage issues.
Yeah. What happens as you age to your pelvic floor?
Well, so we go through this wonderful thing called menopause. And, you know, your hormones change. And so just like in other parts of your body, the makeup of your muscles changes. We have decreased estrogen, so we get, you know, dryness, and we get some laxity in the tissues. Not everyone, but with these hormonal changes, most women will experience some of these little changes as far as dryness, potentially some increase in leakage because these muscles are just not as robust as they once were. It's kind of got that use it or lose it philosophy, just like with
I've heard that.
Yeah, you use them, you're not going to lose it. But if you don't use them, you will lose it. So I do work with all ranges of women. And I especially love working with my postmenopausal women because, you know, I think they go into it assuming, oh, you can't help me here, right? This is just a normal part of aging. But, you know, retraining muscle connections, the mind-body connection, we learn that throughout all stages of our life. And we can recruit those muscles better with utilizing pressure management strategies that you would learn in physical therapy. And I may not be able to increase the dryness aspect, but I can certainly increase the muscle activation aspect so that you don't leak and that you can still have pleasurable sex later in your life. So
Yeah. Now, when you say use it or lose it, what do you mean?
I mean, have intercourse. I mean, do your pelvic floor exercises, do your abdominal exercises, just do aerobic activity and get the blood flowing.
Yeah.
Really, really simple strategies. Like just if you're inactive, just start a walking program. It'll have profound changes, not just for your heart and your mood, but it'll affect the pelvic floor. We're increasing blood flow to that area. So anything that will increase blood flow is gonna give you benefits.
See, now you mentioned that, and there was a time that I started doing kickboxing and quickly realized that for my pelvic floor, this wasn't going to work for me. So what are some good exercises that parents can do post-baby? And then also, I have another question to add on to that after.
Sure. So a really great thing to start doing post-baby is to start doing your Kegels, to start really trying to connect to your pelvic floor again. So thinking about squeezing like you're trying to pick up a marble with your pelvic floor. So squeezing between your sit bones, right? Your sit bones, sit bone, trying to connect those together after you have a baby is really important because you've had such a stretch to that area throughout pregnancy and throughout vaginal delivery, if you deliver vaginally, that you almost lose the connection of how do I make these muscles work because they are so fatigued and they are stretched incredibly far. Really, it's amazing.
Yeah,
things can stretch, but Kegels would be my number one thing, and then I would also suggest that people start connecting to their transversus abdominis, which is their deep inner core muscles. So it's not just sucking your belly button into your spine because that's just going to turn on the rectus abdominis. It's deeper than that. So imagining that you have a wire between both of your hip bones and trying to gently pull that wire towards the center is going to connect the transversus. And you should find that if you connect transversus, you actually get a reciprocal lift with your pelvic floor. So oftentimes people are having trouble turning on their pelvic floor. I'll start with the abs and I'll have them try working their abdominals to get that pelvic floor working, and vice versa as well. Yeah. So those isometrics is where I would start with postpartum moms. Yeah.
Awesome. And are there things that you would not do?
That's a great question. That's probably a more individual basis. It really truly depends on their level of fitness going into the pregnancy. I guess maybe it's a blanket statement. I would say no high intensity interval training for like the first probably 6 to 8 weeks postpartum. If you were a runner before, you can return to running after having a baby, but give yourself a break. Give yourself some time to heal. If you had an episiotomy or if you had any tearing or any kind of surgical scarring, you need to let all of that heal before you really go high intensity interval training.
That makes sense.
Yeah.
So why is it important to work with a physical therapist to find what's right for you?
Well, kind of like going back to your point where you said you tried the kickboxing, right?
Yeah.
You're doing was that a novel task for you? Had you ever done that before?
Right, not in a long time.
Okay, all right. So I think that's a perfect example because if you were on your own and you find, okay, I'm leaking or I feel heaviness or like a prolapse or any kind of pressure, then you might be inclined to just say, you know what, I'm just not going to do this anymore. But darn it, you really wanted to do kickboxing, right? Because it's great to lose weight and it's great exercise and it is social and you get to meet people. So that's where I think a physical therapist can come in because I don't want you to stop doing what you want to be doing, but I'm
Yeah.
going to help modify what you're doing so that you can keep doing it. Does that make
Okay.
sense?
It makes total sense. Yeah.
So I don't want people to think, oh, you're going to go to physical therapy and she's going to tell you 50 things that you can't be doing. I
Right.
want to work with you where you're at and help you maintain doing what you want to do or get you to the things you want to do without having to stop doing those things.
Awesome. When is a good time to go to physical therapy?
Excellent question. I really, really, really would love it if all doulas, OBGYNs, nurse practitioners, midwives, if they would say, okay, 6 weeks postpartum, you have to go to physical therapy, even if it's just for one visit to just do a check and make sure that things are functioning properly. Because I feel like so many times women are not given hardly any information in the hospital about, okay, here's how you take care of your body afterwards. Something as simple as like C-section massage, right? We should be teaching women how to massage their scars so that we have good scar healing. So it doesn't lead into any kind of adhesions. I see a lot of women who have visceral adhesions because they're C-section scars.
Tell me more about that. Do you help women with that?
Absolutely, yes. And if there's oftentimes, there's a numbness, right? Most generally, there's some sort of part of the scar that they can't really feel. So I can't fix that per se because that's peripheral nerve damage that's not really going to come back. However, if they're experiencing abdominal pain or if they're, noticing like any symptoms that maybe correspond with digestion, like after a big meal or, things like that kind of tip my mind to think, oh, maybe there's something going on with this C-section scar here. Let's check that out. And oftentimes, usually there is some sort of adhesion. So even years later, scars can be molded. It takes longer, but they can be remolded and reshaped. And that scar tissue that's kind of all thick and bleh, it can lay down in nicer lines if we work it and do manual releases to that area.
Oh, that's amazing.
It is. Yeah, it is.
Is it true that in other countries, women's health and physical therapy is something that's just integrated into postpartum care in a way that it's not here?
Absolutely. In Europe, I'm thinking of France, for example, it is standard postpartum care for women to go to physical therapy.
Wow.
Isn't that amazing?
Oh, it's amazing.
And here, I see so many women who they had to ask their doctor for a referral. And I get it. I mean, they're worried about making sure, we don't have any bleeding and that the vital organs are moving back down where they should. I totally understand, to maintain the health of the mother. But at the same time, I don't feel like they're asking the right questions.
Okay.
I had 2 different OBs for delivering both of my kids, and neither of them asked me, how are your bowel movements? Are you having pain with urination? Are you noticing any issues down there? Even just something like that, something as open-ended as that, I think would be a great question for practitioners to ask their patients. And then that will hopefully lead to more referrals and more women being empowered and educated about their bodies.
Yeah. Now, you say referrals, and I've heard from several different moms who say, my OB will not give me a referral to physical therapy.
Really?
Are there ways? And I know. It's really sad. One was a mom who was experiencing, I think it was pubic symphysis dysfunction, which is like pain in the pubic bone.
Correct.
Yes.
So we're talking about most likely kind of the this ligament here between bones. Oftentimes during childbirth, it can physically separate and then it doesn't come back together. Well, it kind of comes back together like this.
Yeah.
So what I would say is, in the state of Ohio, we do have something called direct access.
Okay.
We are supposed to be able to see patients without a referral. We've had direct access for almost 20 years now.
Okay.
In the private practice world, if you're not associated with a hospital, then you can call up a physical therapy clinic and they can get you in and you do not need a referral.
Okay.
The caveat to that is if you want to see a physical therapist that is in a hospital system.
Yeah.
Hospitals have their own rules and they say you need a referral. It can be from anyone who can make a referral. So it doesn't have to be an OB. It can be,
Okay.
it can be a family doctor.
Mm-hmm.
It can be a nurse practitioner.
Okay.
It can be a chiropractor.
Good to know.
It can be a dentist.
Nice.
Someone who wanted to see me so badly, I said, well, just have your dentist write a referral. I said, what? I said, yes. Legally in the state of Ohio, that can happen.
Yeah.
So there are some independently owned clinics in Cincinnati that you do not have to have a referral.
But then it's private pay, is that correct?
But then it's private pay,
Mm-hmm.
and then you would have to submit it to insurance on your own if you wanted insurance to potentially pay for it. That's correct.
Yeah.
So
Awesome.
I mean, it's still an option, and hopefully we will continue to get better with this. It's definitely a beef of mine that I have to have a physician referral. It definitely hinders my ability to see people when we have to have that extra step of a physician in the middle. Yeah.
Yeah. My midwives were so great when I, just mentioned it that I would like to see a physical therapist, and right away they wrote a prescription.
Yeah. See, and that's the way it should be. And I'm so sorry that you have a mom who experienced that, because I would not say that's the norm.
Yeah.
I think most physicians are open to writing a script.
Yeah. Another problem that I hear so I hear about pubic symphysis pain or pubic pain.
Yeah.
Tell me what that's called exactly. I'm sorry.
We label it pubic symphysis dysfunction.
Okay.
And that's kind of an umbrella term for anything that's wrong with the pubic symphysis.
Yeah. So I hear about that a lot. I hear about like hip and hip pain. And then postpartum, I hear or see online moms frequently say there's a bulge down there that wasn't there before.
Yeah. So that's probably a little bit of prolapse.
Okay.
What they're feeling is a little bit of the tissues are not up like they should be. They're kind of falling down a little bit. Yeah. And it might not be true prolapse. It might be a cystocele or a rectocele, which is like the beginning stages of prolapse.
And you can have all of them. Is that right?
Correct. Mm-hmm. You can even have the uterus prolapsing. So it can be the uterus, it can be the rectum, or it could be the bladder.
Okay.
That issue of heaviness, I would say, is kind of going back to my original point of pressure management. Mm-hmm. They probably aren't as weak in their pelvic floor as what they're thinking, but they're probably utilizing poor strategies with their pressure. I would check for what's called a diastasis recti.
Okay, tell me more about that, because I know that's a hot topic.
Right. So that's where the stomach muscles separate when you're pregnant, and it happens to all pregnant women because the baby has to go somewhere. And then the muscles like to come back together, but sometimes they don't come back together all the way. Mm-hmm. So when they don't come back together all the way, then we've got these muscles in the front of our body that aren't managing the pressure as well as they could. So that probably means that the pelvic floor is doing more of the work for these abdominal muscles that aren't doing their jobs as well. So probably those women who have that feeling of heaviness, if they've got a diastasis, we would work on closing that gap, improving the pressure across those soft tissues in their stomach, and then working on coordinating the abdominals with their pelvic floor, making sure that they're not holding their breath, making sure that they have good alignment. So many moms come to me and they're still in that pregnant posture.
That makes sense.
And that is just a very inefficient way to recruit all of your stabilizing muscles. So we work on breathing. We work on, closing the gap with the abdominals. We work on just managing. I feel like I'm saying the same thing over and over, but just managing that pressure. That's the big thing.
Oh, it's so important to hear. And I've heard that it's not just about getting stronger and stronger and tightening more and more. There's something to be said for letting it go.
Right. You have to be able to release, because so I've got my balloon here, right?
Okay.
And the bottom of the balloon is your pelvic floor. And if all you do is just pull up, 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 what's that going to do to the rest of your back and your diaphragm and your abdominals? If all I do is pull up, 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 that's going to make this pressure system not work so well.
And what does that look like?
Well, and what that will lead to is issues of pelvic pain.
Okay.
Issues of people having what's called dyspareunia, where they have painful intercourse or painful urination, bowel movement. It's going to lead to kind of this globalized tightening everywhere.
Yeah.
Not being able to release. So it's not just stronger, 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 because that's not the answer either. Right.
Gosh, it sounds like pelvic floor is so important for everyone.
And the more I learn, and I am constantly learning new concepts, but the more I realize there's just so much that I don't even know yet.
Yeah.
There's always new research being done. And it is kind of like the hot item, or the trend thing right now. So there's a lot of women that are interested in going and taking these courses. And I think the education is getting out there, and I think the OBs are finally on board with what you guys have always been saying all along.
Yeah.
It just is taken a little bit longer to get to that point.
Yeah, that is so wonderful. Well, I'm so glad that you're here in Cincinnati. How would people find you if they think that they would benefit from women's health, physical therapy in the way of women's health?
Yeah. So I work for Premier Health.
Okay.
Premier Health is an umbrella of different hospitals, primarily based out of state. But we do have Middletown Atrium Medical Center. And I work for Atrium Medical Center in a satellite outpatient clinic at Countryside YMCA in Lebanon. And then I'm also at an outpatient clinic in Mason, right there at Mason High School. So that's probably as far south as I am for your clients.
Awesome.
But if they're interested in getting physical therapy, I believe my contact information, I think, is up on your website.
It is on the network.
Okay, excellent. Yeah. So they can look up phone numbers and things like that there. And I'm not going to hold up a sheet of paper because it'll be backward. So
and we can post all of that in the comments as well.
Oh, great. Okay, perfect.
Awesome.
Yeah, but that's the easiest way to get a hold of me, is either give me a phone call. And I like to just talk to people before we get started, just to kind of make sure that physical therapy is going to be a good fit for them. If they call me and they have, I don't know, saddle paresthesia, like complete numbness in their groin area, and they can't use the bathroom. Okay, well, that's a medical emergency. You're not going to come to physical therapy for that. Do you see what I mean? I want to do like a quick little screen to make sure that they're appropriate for physical therapy.
Yeah, that makes sense. Okay, so we've gotten to the portion where I'm going to ask you a couple of questions about you.
Okay.
Oh, you know what? Somebody has a question, and I'm going to post it here on the screen. And it's Gabrielle Larkin, and she says, just hopping on, this is all so fascinating. At the risk of sounding naive or it being redundant, what is dry needling? Have you talked about it already?
Great question. We have not talked about dry needling, and I love to do dry needling. So that's a great question. Dry needling is where we use acupuncture needles. And the idea with dry needling is that we're trying to help improve muscle function. Blanket statement, improve muscle function, which is going to help improve mobility and improve your pain. So it's similar to what an acupuncturist would do, except my thought process is a little different. Basically, the similarity lies in the fact that I'm sticking a needle into your body. And after that, it's completely different. An acupuncturist will say that they're trying to release the chi and kind of make the energy flow more smoothly in the body. Sure, that's great. Maybe that's what we're doing. I mean, I'm not discounting it because it's been around for thousands of years.
Right.
Where dry needling differs is we are looking at, let's say, for example, you're having pain in your butt, right? Because you're pregnant, and oftentimes our hips go into a lot more external rotation and we get a shortening of the piriformis. So oftentimes the piriformis is to blame for that butt pain. What I would do with an acupuncture needle is I would target that piriformis muscle. I would literally stick a needle in your butt, and that needle is going to allow that muscle to relax. It's going to create a central nervous system cascade of events where it increases blood flow, it increases that tissue relaxation, it releases endorphins and makes you feel better. There's a whole slew of things that will happen just by sticking a needle into your body. And it's more targeted than massage therapy because I know where that piriformis muscle runs. I know my anatomy, that I can really target that specific muscle, versus a massage therapist is going to be pressing and, maybe, I don't know, digging the elbow in or whatever. And this is just going to be a more precise way to get that muscle to relax.
That is so fascinating. I can only imagine what moms say when you suggest that as a treatment option.
And I will tell you, there's debate out there. There are some physical therapists that will say, oh, I'm not touching pregnant moms because I don't want to induce labor. And I will tell you that from all the training that I've done, the pros definitely outweigh the cons. I know that there are certain points in the body that we do know. For example, the outside part of your ankle, right? If we stimulate that area, potentially could bring on contractions. I'm not going to needle that area. So we are very safe to needle the glutes or, pelvic, like hip muscles. Probably not going to needle the abdomen because that just doesn't make a lot of sense in pregnancy. Why take the risk for something like that? But other areas are absolutely safe to needle.
Okay. That is really fascinating. And Gabrielle said she's intrigued. Thank you so much for all of your time and information. I appreciate your work.
Oh, well, thank you so much for joining. It was so nice to have someone else on the line with us, and hopefully else, if I've given you guys some just education out, disseminate education. That's what I want to do.
Yeah, that's the name of the game.
Right. Let people know what's available for them because there is help out there.
Awesome. Okay, so Katie, if you were not a physical therapist, what would you be?
What would I be? All right, so don't laugh, but I played golf in high school and a little bit in college. I love to golf. I would love to be a professional golfer.
Oh my gosh, I love that. Oh, that is so cool. When I mentioned to the physical therapist that I was bowling, she was like, that is horrible for your alignment and everything else. And so I wonder with golfing, I'm sure you've got great form.
Well, so having two little kids, I get to play this much now. But back in the day, I was pretty good.
Yeah.
I hope riding the bike, maybe, once you learn that motor pattern, it just comes right back to you. That's what I'm hoping.
Awesome. Speaking of that, how do you spend your free time?
So in addition to working and taking care of two small kids, Ellie just turned 2, and Jack will be 5 in a few weeks.
Awesome.
I enjoy exercising myself, and I love Pilates. So you'll find me doing Pilates. I also love to teach Pilates.
Awesome.
So I do teach a class at the Y in my spare time. And I love to scrapbook. I love putting together like photo albums and just, spending time doing scrapbooking. That's probably it, because right now I don't have much other free time.
No, that sounds like a lot.
I would definitely be on the golf course if I
could. Nice.
Yeah.
Awesome. Well, Katie, thank you so much for taking the time to share with us all that you do.
Thank you so much for inviting me. This has been really wonderful.
Absolutely. And then viewers can find Katie in the comments. We'll put all of her information, how to find her, and get in contact with her.
Excellent. All right. Well, Molly, thank you. And thank you to all the viewers out there tonight. And I'll put my contact info out there, and just give me a call if you have any questions.
Wonderful.
All right. Thank you.
Bye.
Bye-bye.
Thank you, everyone, for watching the Cincinnati Birth and Parenting Show. This has been so much fun. That was Katie Coleman, who is a physical therapist specializing in women's health. I'm going to put all of Katie's information again in the comments, and you can also find her on the Cincinnati Birth and Parenting Network at cincinnatibirthandparenting.net, which is a huge directory of birth and parenting professionals all in the area. And again, that's cincinnatibirthandparenting.net. If you have any other questions, feel free to reach out. We are always looking for guests to be on the show and share who they are, what they offer, or for parents even to come on and talk about their birth or parenting journey. We would love to connect with you. Now, this information can be found at cincinnatibirthandparenting.agency/show. So just head to cincinnatibirthandparenting.agency, click on show. You can watch all the previous shows that we've had before. And we so look forward to connecting with you again soon. Thanks, everyone.